The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
Thank you all also for submitting really great questions. We're going to get to as many of those questions at the end of this session as we can. There was one question in particular that someone asked, and they said, is there any hope for me? And I hope if you don't take anything from this next 1 hour is that, wow, there are so many ways that we can optimize sexual function. Now, we are both proceduralists. She does a lot of procedures when it comes to the colon. I do a lot of procedures when it comes to sexual function. But at the very basic level, the foundation of how we go about our lives, how we feel, if we like what we see in the mirror, and our ability to function when it comes to our sexual health, the foundation is what we put in our mouths, food, nutrition, and that is going to be the focus of today's webinar. We're going to start by talking about the basics of erectile function, because the only way to understand dysfunction is to first understand normal structure and function. We're going to touch on the impact of nutrition, on exercise, and perhaps most importantly, why this message matters. Let's begin with the basics. The penis is a complex structure, but we're going to simplify it. It's essentially 3 cylinders or 3 tubes. Now, 2 of these cylinders are the erectile bodies. And when we talk about what that tissue actually is, it is literally like a sponge. So the next time you're doing dishes, I want you to think of this analogy. In order for a man to get a good erection, this sponge needs to be put under the faucet, and it needs to essentially become, soaked or entrenched in that water, okay? And that fluid needs to stay in the sponge, okay? Just like in the penile tissue. And you need enough blood flow in to actually fill all these spongy spaces. So we'll talk a little bit about penile rehabilitation tonight and overall the health of genital tissue. But at the very basic level, in order for a guy to get a good erection, we need good blood flow in this very spongy tissue. So how does that happen? When it comes to that underlying process, that's where I want to emphasize this whole nitric oxide process and the nitric oxide as a molecule. Now, nitric oxide is present throughout our bodies. And when it comes to sexual function, and this is in people of all genders, with arousal, you get the release of nitric oxide from nerve terminals. And that nitric oxide leads to this downstream cascade of events that ultimately leads to opening up of blood vessels, which means more blood flow into the penile tissue. We have to remember throughout this entire presentation, nitric oxide. And when it comes to erectile dysfunction, there are a lot of these other medical conditions that can impact the ability of nitric oxide to be released in the penile tissue and how long that molecule will stick around in that penile tissue. So let's talk about some of those common causes of ED. Age, heart disease, high blood sugar or diabetes, and in fact, the #1 and #2 cause of erectile dysfunction is heart disease and diabetes. High cholesterol, as I mentioned, diabetes, smoking, alcohol, obesity, and lack of exercise. All of these factors play a role when it comes to the blood flow that goes to the penile tissue, and they can all impact that molecule being nitric oxide.
And Dr. Amy, I think you've made some critical points here in that 90% of those on that list are actually things that people have control over. I think only one of them, even though someone may have, let's say, a genetic predisposition for heart disease, age is the only thing that is not modifiable.
Absolutely. And so actually for a lot of men that I see who are in their 70s and 80s, when they're keeping themselves healthy and they're eating, good food and they're exercising and they don't have a lot of medical problems, some of those guys have, really great erections, more so than younger guys in their 20s and 30s who are not eating good nutrition. So when it comes to nitric oxide, it's not even just how it's associated with erectile function. That would be a very limited view of what the impact is of nitric oxide, but it impacts everything. So let's look at some of these other boxes in this table. So we have nitric oxide, weight loss, antioxidants, insulin sensitivity. It's not a one-way direction when it comes to any of these factors. It's not, improving nutrition directly impacts sexual function. It is this whole cascade of events that happens. So when we talk about specific tips that you can implement starting today to improve your erectile function or your sexual health, it's really, maybe 10 or 20. There's not one perfect solution. We're not going to tell you at the end of this session, if you eat, a watermelon a day, you're going to be good. It's just making better choices, and each of these choices has the ability to impact sexual function for better or worse. Now, Dr. Michelle is going to hit on nutrition, and what she's really going to emphasize during these next few slides are simple tools. We're not saying easy, but simple tools that you and your loved ones can start implementing immediately.
Yeah. So Dr. Amy, my story started back in undergrad when I was eating poorly because of stress or boredom or anxiety. I had, an exam that I needed to study for, and I started feeling crummy. And I would do it again, and then I'd wake up and I felt like I had a lot of neck pain. And then I finally came to the realization that when I ate poorly, I felt poorly, and I just was tired of feeling crappy all the time. So I stopped eating crap, and my whole life has changed. And so I think a lot of it comes down to me trying to educate people, not telling people what to do, to share my story and to try to get people to make these micro decisions on a daily basis to make better choices so they in turn can just feel better overall. And although most of my practice is based on getting someone to a healthier weight and maintaining that weight, it's really the ingredients that we put in our body that have an immediate role on the inflammation, our systemic inflammation, that has a big impact on how we feel on a day-to-day basis. And that's really what matters to people. Not everyone cares about their weight, but I would argue the majority of people just want to feel well in general. So let's dive into some nutrition.
Absolutely. And just to emphasize real quick, the inflammation plays a critical role on, remember that molecule, nitric oxide. Those two are very much related, and things that promote inflammation, they kill off that nitric oxide molecule. And we need that for good erectile function.
So let's talk about how fat cells affect the body. So 10, 15 years ago when I was an undergraduate, I took a bunch of exercise physiology classes, and what we were taught were fat cells just kind of sit there and don't really do anything, and maybe they're not aesthetically pleasing, but they really don't have any impact on health or disease. And more the research is actually suggesting the complete opposite. Adipocytes or fat cells are extremely pro-inflammatory, and when we have extra fat cells, particularly around the midsection, that's what we call visceral adiposity, that increases systemic inflammation. It triggers an entire systemic inflammatory cascade. And the food that we put in our body has an immediate effect on our gut and our gut microbiome, and that also plays a huge role on systemic inflammation, the microbiome, and how we feel. So we know that if we can get someone to lose weight, to shrink the size of the adipocytes or the fat cells, that systemic inflammation goes down. And that impacts nitric oxide and sexual wellness or sexual dysfunction. So really reducing systemic inflammation by eating anti-inflammatory foods, but also focusing on getting and maintaining a healthy weight really play a critical role.
And going back to what you were experiencing with like your neck pain after eating high sugar foods, is that inflammation that you're feeling?
Yeah, absolutely. And there's no test that's going to tell me that. So we have a lot of these non-specific biomarkers like the sedimentation rate or ESR or CRP. And I took care of people with inflammatory bowel disease who came in with raging flares, and some people just don't secrete those biomarkers. So they could be having a flare with very high levels of systemic inflammation, but those biomarkers were normal. So lab tests will only show so much, and it doesn't necessarily tell someone that everything's normal. So I actually felt, I consider it a blessing. I felt inflammation, I felt pain, and so it finally taught me, it's not worth eating that sort of junk food, particularly things like high fructose corn syrup. And I get patients all the time that it's not about losing 30 pounds, it's losing the first 5 pounds and choosing the right ingredients. People feel better, they sleep better, they have less stress, the kind of food noise and constantly thinking about when they're going to get their next sugar fix, all of that improves. But these require consistent changes, not doing something for one day and thinking magically everything else is going to get better. And we also know that obesity is linked to over 13 different types of cancer. Now, Dr. Amy mentioned that I'm a gastroenterologist, so most of what I encountered was esophageal cancer, pancreatic cancer, and colorectal cancer. And what's very scary is that we are seeing more metastatic colon cancer in young individuals, in those in their 20s or less, without any sort of genetic predisposition. So if we can help choose the right foods, the right ingredients, reduce foods that have shown that they are carcinogenic or cancer causing, and get people to a healthier weight, that is true primary prevention. So although we're really focusing this talk on sexual wellness and sexual dysfunction, when someone has a cancer diagnosis and they're going through chemo, that clearly plays an impact on someone's sexual health.
Yeah, and the other thing that I want to emphasize as well is when it comes to prostate cancer, and there are a lot of questions that were related to prostate cancer, we know that foods that are pro-inflammatory can increase issues related to the prostate, both for non-cancerous and cancerous reasons. So whenever we're talking to patients or guys and they want to do whatever they can to reduce their prostate cancer risk, it also is related to nutrition.
So although gets people into the door to see me is often weight management, they want to, let's say, lose 20, 50, 60 pounds, really weight loss is not the most important thing that we target. It's about learning how to eat well to feel well. It's preventing chronic disease, treating chronic disease, whether it's high blood pressure, diabetes, high cholesterol, improving important quality of life concerns that affect everyday people. And that varies from person to person. So my kind of primary goal when a patient comes to see me in clinic is to understand their why. That's really, what is their why? Why does it matter to them? And then that's how I target my approach. So if someone wants to improve their sexual health or athletic performance, or they want to reduce their pain or their mental well-being, whatever matters to them, the cool thing is that eating better ingredients, again, we go back to this anti-inflammatory type food plan, it improves all of these things. But it's figuring out what does someone like to eat, what is their budget, what does their family unit look like, and then tailoring a program that would meet their desires.
Yeah, and there were some questions related to hormones and specifically testosterone and sexual function, and the recommendations are really the same. Whatever is good for brain health is good for heart health, is good for joint health, is good for overall health, is good for genital health.
Now, I did mention that weight loss is not the most important thing, but it does have benefit. And what does the data show? So a lot of people will, they have a lofty goal. They tell me that they want to get back to the weight that they were in high school. And for some people, that may be a little bit unrealistic, shall we say. But the amount of weight loss that really produces health benefit is starting anywhere from 5 to 15%, okay? So if someone is 250 pounds, and let's say they want to get down to 170. Well, they don't have to get down to 170 to be a healthier person or improve their sexual function. Really, we'll target, let's say, 10% to start. So I'll tell them, let's lose the first 25 pounds. Once you reach the first 25 pounds, then we're going to talk about the next 25 pounds. So it's about making small goals, making like a timeline so that it keeps you accountable. And that's really what helps people not only lose the weight, because believe it or not, Dr. Amy, we all know that that's not the challenge. The challenge is actually losing the weight, but maintaining that weight loss as life happens. And as we get older, and if we have, certain medications, or we have an injury, or, we get COVID or something, so many things affect our life that the typical scenarios, people will gain weight with time. And the goal is to try to maintain a normal weight as close to normal as possible. So people ask me all the time, so what diet should I do? And Dr. Amy and I can attest.
Oh, we did like the
cabbage soup diet, Atkins, Weight Watchers, you name it. Really, any diet works because most of them are very restrictive. So it forces people to restrict their calories and be more mindful of what they're eating. But every diet works, but only to a certain extent, okay? It all comes down to what can someone do long-term to keep the weight off. So really, I rarely use the term diet because it's a very finite thing. And people often tell themselves, well, I'm going to do a diet for 30 days and then I'm going to go back to my prior eating habits. They are dietary changes. They are lifestyle changes that we have to continue for the long haul. So I go for the low-hanging fruit, pun intended. When it comes to nitric oxide and reducing systemic inflammation and getting rid of a lot of the processed ingredients, it means avoiding or limiting the following things. We start with beverages because particularly, we live in Miami, it's the Cuban coffee, it's a lot of these kind of sugary drinks where we're adding creamers and sugar, and that also includes artificial sweeteners, which stimulates cravings for more sugar, believe it or not.
Which is crazy because I feel like for 15 years of my life, I was putting artificial sweeteners on everything that I ate, and I was probably at my heaviest weight during that time.
Yeah, and I think a lot of people just don't realize that although the diet food industry, billions of dollars, and every day there's thousands of additional products that are added to the market, our body doesn't recognize a lot of those ingredients. And so what ends up doing is actually stimulating inflammation because our body sees these foreign molecules and says, what is this? I need to get rid of it. And it can trigger some autoimmune conditions, things like Crohn's disease or ulcerative colitis. So we're finding that these ingredients that are in typical diet foods that people are choosing to consume to hopefully get in better shape and eat better are actually doing quite the opposite. But we target the liquids first with sugar because that's a pretty easy thing to target. And people will go through sugar withdrawal. So if you tend to have, let's say, 3 sodas a day, I wouldn't tell someone from the get-go, cut out all added sugar. No soda, you can never have soda ever again. Because as soon as I tell someone they can't have anything ever again, then all they do is crave that. So I start with saying, okay, you're having 3 cans of soda per day currently. This week, why don't we cut down to 2 cans a day? And then next week, let's cut down to 1 can a day. Or if someone's drinking a lot of coffee with creamer and sugar, let's say they do a tablespoon of creamer and 2 packets of sugar. I'll say, continue the creamer, go to 1 packet of sugar. Then cut out the creamer, then cut out the second packet of sugar. So it's a stepwise progression to get people's brain used to getting satisfied with less sugar. And we've trained our brain from when we're babies, the juicy juices of the world and the concentrated applesauces and the baby food and formulas that have a ton of high fructose corn syrup. We have to retrain our brain to actually feel satisfied with natural sugars like fruit.
So, Dr. Michelle, you're talking about sugar as if it is an addiction or can be an addiction. How addictive is sugar?
So, it's interesting in that obesity and really the sugar addiction has more healthcare associated costs and deaths from things like alcohol, tobacco, and drugs. And, we're in Miami, but we don't see billboards for cocaine or heroin, at least not where we are. But everywhere we turn, what do we see billboards for? Donuts and pizza and all the things that we as providers are telling people to try to limit, but yet TV and social media and billboards, we're being bombarded. So it's not that people are weak. It's that food manufacturers are very smart and they know exactly how much sugar and how much salt to put in our food to get us hooked, okay? And it's a true phenomenon that these ingredients stimulate reward centers in our brain, it releases dopamine, and it makes us feel good. So when you're stressed, you're bored, you're anxious, you're sad, you're socializing with friends or family, you have an uncomfortable feeling, the easiest way, Dr. Amy, to get rid of that feeling is to eat sugar and something salty. And we're trained to do that from when we're babies.
And is it true that sugar is as addictive as something like heroin or cocaine?
Yeah, absolutely. So it's very challenging. Now, we're very fortunate to have medications currently that can help kind of break that cycle, but that's the hardest part, is teaching my patients how to get rid of these added sugars, which many times we're not even aware of. And in particular, the artificial sweeteners, things like mouthwash have sucralose in them. So a lot of things that we use on a daily basis have these sweeteners in them to improve the palatability. So we focus on the beverages. We want to limit added sugars, so the baked goods, the candy, things like that. Now, salt. Our body needs sodium in order to function properly. The problem is that a lot of our food just contains extremely high levels of salt. And when we go to a bar, Dr. Amy, what do they typically give to people for free? Well, they give mixed nuts that have a lot of salt, or you go to a restaurant and they give you chips and salsa. It's not that they, feel bad for you because you're hungry, okay? That salt stimulates thirst. And how do restaurants make money? They make money off of their alcohol. And we know, Dr. Amy, that alcohol also doesn't play the biggest role on improving someone's sexual function.
Absolutely.
So all of these things, again, I can't change the restaurant from offering those types of foods, but Dr. Amy and I's role is to really educate you all so that you're aware of these things, so that if you make these micro decisions, these better decisions on a daily basis, you have so much power to improve so many aspects of your quality of life. And then trans fats, so fried foods, we clearly would want to minimize those.
Gosh, you're a real party pooper.
Yeah, I am. So let's talk about meal prep, because most of my patients are not going to meal prep. They want quick options. They want things that they can do on the go, that are travel friendly. And I'm not a gourmet chef, but there are more options in the grocery store nowadays that do make it a little bit easier. So let's talk about some options that you all can implement on a daily basis. So meal prep 101. We have so many tools in the toolbox when it comes to, vacuum pumps or traction devices or penile injections for erectile dysfunction. I use, similar tools in the kitchen. I don't use the vibrator in the kitchen, okay? But we can use tools that make it a little bit easier and save us time. So whether that's an Instapot or an air fryer or like a George Foreman grill, you can make things in bulk, put them in Tupperware containers. I have a vacuum sealer, so it keeps the food even longer fresh, and I'll put it in the freezer. You can get already hard-boiled eggs. You can put, a bunch of chicken in your Instapot, cook it, shred it, and save it for later. So use the tools in your toolbox to make it easier for you. Meal prepping, you don't have to set aside a whole day to do it.
What's one of your favorite things to put in an air fryer? Like, what's a good snack?
A good snack?
I like carrots in the air fryer.
Oh yeah. Oh yeah. Those are a big one. So like baby carrots, or you can do like the long carrots and you can peel them. Not necessarily a snack, but I love putting, let's say, like salmon in there, and I just dump a whole ton of veggies. If you're, craving, let's say, French fries, then some stores will already sell like the pre-cut, pre-crinkled sweet potato fries, and you can put a little seasoning on that, maybe spritz a little bit of olive oil, and throw those bad boys in the air fryer. So lots of options out there, but get creative and use those tools in the toolbox. So you can use your grill. Now, I also want to make a point here that you want to make sure that you have high quality tools, okay? Because if you are using tools at high temperatures or using cooking oils at a higher temperature than what they're supposed to be used at, that can actually be carcinogenic, okay? So if you want to, let's say, grill veggies, that's great, but I would limit actually charring the vegetables. And you got to be very careful actually grilling some proteins, because they release certain carcinogens that can be problematic. So you don't want to cook at super high temperatures. I like the air fryer because you can control the temperature, but make sure you're using the correct oil for the temperature that you're cooking at. That's actually very important. So you asked me what are some of my favorite things to use in the air fryer. This is one of them. So everything was literally dumped in the air fryer besides the fresh avocado. So that's salmon, it's a bunch of veggies, cauliflower, green beans, sugar snap peas, and some sweet potato fries. Now this would not be a serving for one person. It would probably serve 2 or 3 people, but super easy. And has the protein that you need, which is very critical.
So would this be an example of a very anti-inflammatory dinner?
Absolutely, because the key to inflammation or reducing inflammation is the gut microbiome. What a lot of people tend to forget is our gut is our largest immune organ. Okay, so let's put things into perspective here. We have billions of bacteria in our microbiome. Okay, what we eat on a daily basis has a direct and immediate impact on the microbes that inhabit our microbiome. So if we choose trans fats and high fructose corn syrup, that is going to cause dysbiosis, okay, or changes in the gut microbiome that jack up our systemic inflammation and can lead to a lot of bad issues down the line. So if we can choose these anti-inflammatory foods to really create a healthy microbiome, that's really where the money's at. Now, a lot of people will also ask me, how many meals do I need to eat a day? And do I need to eat every 2 hours? And how many snacks should I have a day? In general, we want to eat when we're hungry and stop when we're full. It's fairly simple. So breakfast is not actually the most important meal of the day. Breakfast is breaking the fast. And so if that's 7 a.m. and someone's hungry, or that's 10 a.m. and someone's hungry, that doesn't matter to me. I just want people to eat good food when they're hungry. Now, the other important thing though to bring up is I don't endorse not eating all day, then feeling hangry, and then stuffing our faces with 2,000 calories at 10 o'clock at night, because if people are engaging in sexual activity right after, they're for sure not going to feel well after eating 2,000 calories at 10 o'clock at night.
What are some of the other symptoms that someone might experience if they're eating too late at night?
Yeah, so the food empties from the stomach. Part of it is a gravity issue. So if you eat, let's say 2,000 calories at night, and a large portion of that is fat. Let's say you have like a tomahawk steak or something, 16-ounce steak at a restaurant, and then you go home and then you lie down. All that fat is now sitting in your stomach, okay? And because you're lying back, the stomach is going to take longer to empty. So it may take you, let's say 4, maybe more hours, depending on how much you ate and how much fat to empty. So it's a gravity situation. It's a mechanical process. If you lie down and you have a ton of food in your belly, you're going to start refluxing all night. And then you're going to wake up, you may have a sore throat, it's going to impact your sleep, and people just don't feel well in the morning. So you definitely want to front load more of your calories earlier in the day, but it's going to depend on the person, what time they go to bed and what sort of activity they have. But in general, when it comes to snacks, eat when you're hungry, stop when you're full. So if you're hungry in the middle of the afternoon and you're not ready for a meal, by all means have a snack. But again, we want to choose healthier options and not necessarily go for that candy bar or protein bar, which are often extremely processed. So things that are very easy to implement, that are already kind of prepped for you, is grab an apple or grab some berries, throw some berries and maybe put them on top of like a plain Greek yogurt or the little snack packs of nuts.
Yeah, so there was a question posed about, what are healthier sugar options? Mm-hmm. So natural sugars.
Yeah, exactly. It's not, back in the day when I used to compete in bodybuilding, I would take out literally all sugar and not eat any fruit. And we have that mindset that fruit is bad, it's too much sugar. I mean, yeah, if you eat an entire watermelon, that is a hell of a lot of sugar. So it's all, again, about moderation, but fresh fruit, or you could do frozen fruit, is a very good source of fiber because that feeds the microbiome. That really helps kind of diversify the microbes in our gut. The fiber is great for bowel health. So if you're able to evacuate your bowels, that can also actually have a positive impact on sexual function.
Yeah, one of the best recommendations you've provided, because I like sweets, but it's fresh fruit or frozen fruit that I defrost and I put it on Greek yogurt. So for those of you who like ice cream, this honestly is a great satisfier.
Yeah, and it's going to take time for your brain to actually get satisfied eating fruit if you're used to having candy and baked goods or diet food products, because these artificial sweeteners and high fructose corn syrup is sweeter than like regular table sugar. And artificial sweeteners, depending on which one you're looking at, are 300 to 600 times sweeter than natural sugar. So it teaches your brain that you're going to be satisfied having a sweetness level up to here. Okay, so it's going to take time for you to eat berries and Greek yogurt and be satisfied, but you just have to retrain your brain, and that takes time. Now, when we talk about snacks and we're talking about fruit, one fruit does not mean one portion, okay? So when people say they have one banana, if you get a banana that's this big, that can actually be, let's say, 3 servings, so it ends up actually being a lot of sugar. So what I tell people is when they go to the grocery store, find the smaller apple or cut the large banana in half, and that's really a true serving of what fruit actually is. Now, I'm not endorsing Nutella. I'm not endorsing Lay's potato chips. This is just go to show that it's just as easy to grab a snack pack of hummus and have that with pre-cut celery sticks than it is to grab a bag of chips. And also these snack packs are not necessarily snack packs worth of calories. So if you buy a small bag of like the mixed nut and fruit, that may have 400 to 500 calories. So just because it looks like a snack doesn't mean it has the calories that we should be eating in a snack. That's really the amount of calories that's in a whole meal. And too much of a good thing is not necessarily a good thing. So it's all about moderation and portion control. The problem is that in my 14 years worth of medical training, no one really taught me the basics of like what a true portion is, what our body needs to function and survive, and not just function and survive, but truly thrive and feel our best at really any age.
Yeah, when we think about these snacks, I'm also thinking like, okay, it's end of summertime, or if any of you all have kids and kids are going, back to school, these are great snack options for traveling and for going back to school, or these single package nuts and celery sticks. And we all know when we go to the airport, we get, if you want to get nuts, it's a huge package and that's like over 1,000 calories. And I mean, I know what I do. I eat the entire thing, even though I know it's super high in calorie. So it's really setting ourselves up for success, and whatever environment we're in, school or work or traveling, is understanding they're not going to set us up for success. We have to kind of do that for ourselves.
Yeah. And I think the key point here also is that how we eat at home has a significant impact on how our kids eat, and what they learn as far as healthy eating behaviors. So I know a lot of people will say, oh, I have the chips at home because my kids eat them. But really, if we can train our family members to choose better choices and create a safe place at home and at the work, then it really sets everyone else up for success.
Absolutely. And even going back to sexual function, even though a lot of this talk is based on erectile dysfunction, the recommendations in terms of what we're talking about pertain to people who have any type of body part, and nutrition impacts libido, and do we like what we see in the mirror, and do we feel good naked, and do we feel desirable, and do we desire our partner, and the structure and function of our genitals.
And so a lot of people, particularly in Miami, we love the rice and beans, or we love the pasta, but there are other options out there, whether it's fresh, frozen. You can do riced cauliflower, you can do the zucchini or spaghetti squash. Those are some of my favorites. Now, let's say you have someone at home that really likes just white rice. Well, you can kind of sneak in some other ingredients there. So you can do, let's say, some jasmine rice. You can mix it in with a riced cauliflower, so they still kind of get the texture of the regular jasmine rice, but you feed your brain because you see a huge bowl of white things, but you end up actually saving a ton of calories and starches or carbs, because you're kind of doing a half and half sort of combination.
Are there some seasonings that are better than others when it comes to GI symptoms?
Yeah, so, a lot of people are not going to feel sexy if they have a lot of gas or bloating or diarrhea, and so a lot of
and I don't need a study to tell me that. I think we all know.
Exactly. And a lot of these quote unquote healthy ingredients that are good for the gut actually don't help people feel too sexy. And those include things like garlic and onion. So these ingredients are high in certain carbohydrates called FODMAPs. And they are certain carbohydrates that, when they're broken down by bacteria in our gut, they form gas molecules. So if someone, tries to eat an anti-inflammatory diet and they do a whole stir fry, and they maybe add, some oysters in there for, if they think it's an aphrodisiac, and they put a ton of, let's say, fresh garlic and onion, they may not actually feel too sexy because they may have a lot of gas and bloating. So it also comes down to eating foods that make you feel well, and everyone is different. So you want to choose foods, if people suffer from gas or bloating, is to limit those high FODMAP foods.
Yeah. And let's talk a little bit about, you mentioned it's not just what we eat, but it's how we eat. What does that mean?
I didn't really realize that until probably 14 years into training and really sitting down with people for an hour, hour and a half to really go over their dietary habits, that I was so used to in the past talking about calorie counting and macros and how much protein, fat, and carbs we should be consuming in a day for an overall healthy lifestyle and weight management approach. But what I learned is how we eat is just as important as what we eat, how much we eat, and when we eat, okay? And so if we are eating really fast, we end up swallowing a ton of air. That's called aerophagia. And then that can contribute to burping, acid reflux.
Not sexy.
Not sexy. Not sexy for most people. If we, and that also, if we're not chewing our food, then that will lead to maldigestion and malabsorption. Also not sexy because that can lead to issues with bloating, diarrhea, etc. Also, we end up overeating. So if we're not mindful of the actual process of eating, we end up eating a lot more calories. We don't give our brain the 20 minutes it requires to actually feel full. So we eat 1,000 calories, and then 20 minutes later, we realize we probably should have stopped eating 10 minutes prior because now we ate too much. And now, again, we feel bloated, we don't feel too well, and that's not sexy either. So changing these dietary habits, things that we were never actually taught how to properly eat, are actually some of the hardest parts about my job. It's not prescribing medications, it's changing eating behaviors in adults. Now, I would never endorse eating any of this, but let's talk about what's realistic for people. If people are traveling or they're going out to eat and they really want a burger and fries and ketchup, then I'll tell people, okay, if you have the urge to be part of the clean plate club and finish the whole thing, then when you order the portion, just tell the server, pack up half of it in the carryout container and only put half on the plate. And that way you don't have the urge to finish everything and you save half as many calories. Or you can do little adjustments like saying, I don't want the bread, and maybe seeing if they have iceberg lettuce and use the iceberg lettuce as a bun, or saying, don't bring me the ketchup, or just using half of the bun instead of both sides of the bun. So there's still ways to satisfy cravings, but again, making better choices, not perfect ones. And then lastly, a couple other things to add with the tips and tricks when dining out. Not all soups and salads are created equal. So this is an example. I'm not going to say where it's from, but someone who may be health conscious is going to get, let's say, a chicken Caesar salad and a broccoli cheese soup. Now look at all these ingredients. I haven't counted them, but there's probably over 50, maybe even 100 ingredients on here. Okay. So when people don't feel well, and they come to me and they say, Doc, I had a salad and a soup. Why don't I feel well? There's no way I can tell them why that was. It may be that they consumed 800 calories in a short period of time. It may be that they had 50 grams of fat, which was way too much, and now it's all sitting in their stomach, or maybe 1 out of 100 ingredients that didn't bode well with them. So again, not all soups and salads are created equal. We can make better choices. And that may just start with getting like a garden salad that still has some ingredients, but at least less, a lentil or like a vegetarian type soup. And maybe getting like shrimp or grilled chicken or something like that on the side for added protein with the salad. And it's less ingredients, it's less calories, and more anti-inflammatory food.
What's a better choice for a dressing for a salad?
So definitely not a creamy dressing. They often have a ton of sodium and a ton of fat. So I'm just a fan of, not even really like a balsamic because it's actually high in sugar, but doing like a red or a white wine vinegar and a little bit of olive oil would be good choices.
Mm-hmm. And always asking for the dressing on the side and then kind of dipping your fork in and tasting it a little bit with each bite.
Exactly, because most of these salads, when people are making a conscious decision to make better choices, people don't realize that some of the quote unquote healthy options on the menu actually have the most amount of calories.
Mm-hmm. So let's talk about exercise. And it's not about, doing exercise doesn't necessarily mean that you have to go to the gym and do free weights, right? It's figuring out how can we move our bodies on a daily basis in ways that we enjoy. And it's important because it goes back to that darn nitric oxide molecule. And what we know about sexual function and heart health is whatever is good for the heart is good for the genital tissue. And we know that moving our body, it's all about blood flow. If we move our body, even just simple walking, it doesn't have to be running a marathon. It could be walking and doing some resistance training that increases blood flow throughout our body, including to our genital tissue. And even, research has shown this as well. 160 minutes for 6 months can contribute to reducing erectile function problems in men.
Now, in reality, if I have a patient who doesn't do any exercise, I just want them to get moving, and so usually what I'll say is, I want you to commit to 20 minutes, 3 days a week. And if someone tells me that they don't have time for that, then I need to talk to their boss, or I need to talk to their partner, or we need to figure out how they can be more efficient with their time, because we all should have 20 minutes, 3 days a week to really commit to ourselves and our body, the only body we'll ever have, to move it.
Yeah, and a lot of this talk is we're really at the essence talking about using food as medicine, but also using exercise as medicine.
And just planned activity. Mm-hmm. Some people may have a negative connotation with the term exercise. It's just moving our body. And that may be, if people are kind of death by Zoom, stuck at meetings, it may be you get some dumbbells or resistance bands. And when you're on video, you can't even really see. You may see my shoulders moving just a little bit, but I could be holding a band right now doing arm exercises, or getting like a standing desk, or like a treadmill with the desk kind of integrated in that. There's so many ways to integrate movement in our daily routine so that you don't have to put on gym clothes, take an hour out of the day, go to the gym. There are ways to easily implement it.
And there's no study that tells us that one specific exercise is the key to optimizing sexual function. And I see that as a good thing. It means you don't have to necessarily do Zumba or yoga or something that you may or may not enjoy to improve sexual function. You just find activity that you like.
So when it comes to physical activity recommendations and weight, exercise is not actually a good tool for weight loss. So people will often spend a lot of money on a personal trainer, and then they get frustrated because they don't see the number on the scale changing. But it is incredibly important to help someone maintain their weight loss. And why is that? When people lose weight, they often lose muscle if two things. One, they're not eating enough protein. And two, if they're not doing resistance training, they will lose muscle. And what happens is that you end up losing muscle. That lowers your metabolic rate, and your muscle mass is the key to your underlying metabolism. And so you end up actually increasing your risk of weight regain, because at your goal weight now, your metabolism is actually much slower. So you were able to get away with eating before, you won't be able to get away with anymore. And that's really what feeds into this whole vicious diet cycle. So the key role here is, before starting any sort of weight management program, is to get used to moving your body, incorporate the weight training so you can maintain as much muscle mass as possible during your weight loss journey.
So does this explain why when we do fad diets and we lose a significant amount of weight and then we gain it back, we oftentimes gain more weight than where we started?
Yeah, absolutely. And our hunger hormones change when we lose weight. So people, when they lose weight, they're like, my hunger, I'm just super hungry. And that happens, okay? Although we may not be comfortable at a heavier weight, our body is doing just fine, and it's gonna fight the process. And we have hormonal issues and stress, and we're losing muscle if we're not doing it properly. We're gonna end up being hungrier when we're at a lower weight because of changes in leptin and because of the changes in the adipocytes and whatnot. Our hunger hormones get altered. And if we have less muscle, we now want to eat more, but now our metabolism's slower. So we start kind of, quote unquote, trying to add in things that we kind of used to eat, and we realize we can't get away with it anymore. So I'm very transparent with people up front that when you go on a weight loss program, whether it's with or without medication or bariatric surgery, that these are lifestyle changes, that you're going to have to restrict your calories and move more. And once you get to your goal weight, that doesn't stop. You have to continue doing what you did to get there in order to just maintain. And that's critical because of what we call a concept metabolic adaptation.
And I want to touch a little bit on exercise, but specific for genital tissue. And MenMD sells some of these products. So when it comes to just exercise of the penis, getting stretch on a regular basis is key to maintaining tissue health. So even if we take sex and masturbation and intercourse out of it, to maintain the health of the penis, just like I would maintain, got these guns here, my biceps, I have to lift weights on a regular basis. If I stop lifting weights for a period of time, my muscle in my arm is going to shrink or atrophy. And the same thing happens to the penis. When the penis is no longer getting stretch or erections on a regular basis, it can shrink both in length and girth. So getting on a good penile rehabilitation or exercise program, whether it's with medications like Viagra, Cialis, injection therapy, vacuum pumps, all of these things can be great tools for exercise of genital tissue.
Yeah, and it all goes back to the tools in our toolbox. We have amazing things out there. So our goal is to educate people so they know where to go to get these products, whether we're talking about an air fryer, a George Foreman grill, a vacuum pump or traction device, there are options available to help you all on your journey.
Yeah, and there's not one thing that's going to work for everyone. So I wouldn't just expect to buy an air fryer and use the air fryer to fix all of my issues, right? So a lot of what we're talking about, it's not a specific exercise or eating a specific food. It's really doing everything that we can on a daily basis. That's where we're going to see the great results. All right, so let's get through some take-home messages and then we'll go through some Q&A. This is about making better choices, not perfect choices, starting today. So think about, I'm not sure where you're at in the country. It's almost 8 p.m. on, Eastern time here. And I'm thinking, I kind of have a sweet tooth tonight, but I'm going to eat some yogurt and some fruit. So that's how I'm going to end my day. So what are you going to do to make a better choice starting today? And understanding that nutrition and exercise are the foundations for optimizing sexual function, and that is a beautiful thing. Those are non-invasive. They don't cost a significant amount of money. We're not spending thousands of dollars on some regenerative therapy. These are things that we can incorporate on a daily basis to optimize our sexual function.
And really, it all comes down to investing in your wellness today, or you're going to be spending a lot of money on health issues later.
Yeah. So the reason why I wanted to bring up this device right here, this is a device that is sold by MenMD. I'm on the medical advisory board for this company, so I do get the privilege of knowing a bit about this product. But this product is both diagnostic and it can be therapeutic. So one of these bands goes around the testicles, the other band goes around the shaft of the penis. And there's an iteration of this device that actually has a sensor in it that can give us real-time information about the erectile health. And before, talking about the exercise component, before there's erectile dysfunction, there's erectile fitness. And we know, we all love wearable devices, right? We have our watches, we have our Oura rings. We want to understand our sleep and our nutrition and our gut symptoms and our exercise. And there's really a gap in the market when it comes to understanding our baseline sexual function. And that's where this device can be really helpful. And what this device also allows people to do is understand, as you start to make these great lifestyle decisions, what is the impact on erectile health? I can quote as many studies as I want or you want me to quote when it comes to the impact of nutrition on sexual health, but what is it for you? What can you eat that either makes it better or worse, or what activities make it better or worse? And you can actually track that in real time by using devices like this. So that's what I find to be interesting about the FirmTech device, and you can get it from the MenMD website as well. So let's go through a couple of questions. We have about 10 minutes left. So I'm going to put Dr. Michelle a little bit on the spot here, and we'll first tackle some nutrition related questions. So is it not a good idea, or is it a good idea to have sex immediately after eating?
So, exercise is sexual activity is mild to moderate exercise for most people. And it really goes back to, should we be eating a lot of food right before we exercise? I don't know if you all have ever heard of the term runner's trot. And what happens is that when we eat, our blood is shunted to our gut to help us digest. So if you can imagine, if I were to eat a large meal that's high in fat, and then I go for a run right after, I want my blood to be shunted to my gut, but it's actually going to preferentially shunt now to my muscles because I'm exercising my muscles. And then the blood flow is going to go away from my gut, and people can actually get what's called like ischemic colitis or ischemic gut, where you have poor blood flow to the gut when it's trying to break down food. And it's called runner's trot because people can actually have things like bloody diarrhea. So the same thing goes with sex. After eating a large, it would be pretty vigorous sex. But in general, after you eat, particularly a large meal, you want to give your body, the time and the blood flow to properly digest the food. Plus, oftentimes when you eat a large meal, you're not going to necessarily feel so sexy engaging in sexual intercourse. So nothing against having like a snack or something, but you definitely don't want to go to, a 5-course meal or, a buffet and then engage in sexual intercourse. You're probably not going to feel too sexy and probably won't feel too good.
Yeah, and it can also impact how medications work in our body. So a medication like Viagra or sildenafil, it actually doesn't work as well if we take it right after eating a meal, especially not right after a fatty meal. So a lot of the times when people take these oral medications and they come in to see someone like me and they say they're not working, I always go back to asking, how did you take the medications? Did you take this medication on an empty stomach? And oftentimes it's not the medication that failed the person taking it. It's that we as healthcare providers didn't explain to the patient how to appropriately take this medication. Now, other oral therapies don't have to be taken on an empty stomach to work well. That's where tadalafil or Cialis can be very beneficial. It doesn't matter how you take it when it comes to food.
Okay. So someone would like to know, how does a big belly affect sexual function?
So at the very basic level, it's how do we feel about ourselves? And do we feel good, sexy, desirable, naked? Now, not everyone has to feel that way in order to engage in sexual activity, but we really have to acknowledge that very important aspect of sexual health, and we can't ignore that. Now, most urologists are not going to talk about, well, how do you feel about your body image? And I think that's actually a big loss. I think we're providing a disservice to so many people we see by not acknowledging the self-image concerns. But also, having excess fat can bury the penis. It's called an escutcheon or suprapubic fat pad, and that's that area of tissue that's literally sits right above the penis on top of the pubic bone. And depending on how much excess tissue is there, it can bury inches of the penis, which can actually make it difficult or impossible for penetrative intercourse. So that's where it can cause issues. We call it a concealed or a buried penis, and weight loss, nutrition, exercise are really going to be the foundation for helping with that. Now, some guys, even after those different types of interventions, it can still be difficult to lose that excess tissue. And that's where we have some either liposuction or surgical options that can help with that area. But also with different therapies. So MedMD, very popular with medications that you would inject into the penis like Trimix. If you're not able to see or visualize the penis, I've also had some guys put the needle somewhere and you don't have any idea where it is just because they can't see the penile tissue. So if that's a concern for you and you are doing penile injections, would recommend doing it in front of a mirror or having your partner help you so you're actually getting it into the right spot, because that could be a reason why the injections aren't working if you're not actually getting it into the right area.
Okay. Are there any special considerations for a post-prostatectomy patient?
Yeah, and I know a lot of people, tuning in have either concerns about prostate cancer, have prostate cancer, and they might be on active surveillance or undergoing treatment, have undergone treatment either with, surgery or radiation therapy. And when it comes to sexual health and prostate cancer treatment, there are no prostate cancer treatments that improve sexual health, okay? And because of the anatomy, the nerves that are responsible for erectile function, they're plastered right on the prostate. So no matter how careful or delicate the surgeon or radiation oncologist is to really target that prostate tissue, the nerves are going to be impacted. Now, a lot of people will recover some function up to 12 months after surgery when it comes to erectile function, but some people won't. And depending on where the prostate cancer is located, some people aren't able to have a nerve-sparing approach. So really, when it comes to nitric oxide and these therapies that we're talking about, improving our nutrition can help, but that's where injection therapy can be particularly helpful, is after prostate cancer treatment, if those nerves are damaged or they're still recovering, the pills might not work because the pills rely on nitric oxide. So that's where the injections, or let's say a penile implant, can be helpful because they are separate from this nitric oxide pathway. So there was another question that asked, if someone's on injections or has a penile implant, will changing one's nutrition help? And yes, it will, because the injections work via a non-nitric oxide pathway. If you improve nitric oxide and you do the injections, then you're increasing blood flow via two different pathways, and that can help with blood flow. Now, for guys who have a penile implant, you might say, okay, well, I already have an implant in those erectile bodies. How might changing nutrition or blood flow or taking something like Viagra Cialis help? Well, the gland or the tip of the penis is a different structure than the erectile tissue. So we still want to optimize blood flow to the tip of the penis, and that's where these other therapies can play a role.
And to use some of these tools that you mentioned, like, a traction device or a vacuum pump, someone doesn't need to wait until they have dysfunction, right? So we talk about penile rehabilitation, but just to optimize someone's sexual function and fitness, can these tools be helpful?
Absolutely. So just like with nutrition, a person doesn't have to be overweight or have GI symptoms in order to benefit from a good, sound nutritional plan. And that is the same when it comes to sexual function. So whether it's incorporating a vibrator, or let's say you get good erections, but you want to try something like a vacuum pump, or you want to use something like this Firm Tech device, that's okay. You don't have to have a problem in order to warrant using any of these therapies. I have plenty of guys who get good erections, but there's a thought in the back of their mind that's like, oh, am I going to be able to get a good erection? Should I even initiate? I put some of those guys on a daily Cialis and it becomes a non-issue. They don't even think about it because they know they're going to be able to perform. So a lot of these therapies play a role in people who are, perfectly satisfied with their sexual health. Now, there were a few questions that asked about medications that can impact sensation, and there are a lot of medical conditions that can impact sensation. So it's one thing if someone can get a great erection, or, but if they can't feel anything, or you can't reach climax or experience pleasure, what do you do in those cases? And that's where it becomes, you've got to get a little bit more creative, right? Going back to the tools in our toolbox, vibrator products can be helpful. As people get older, people just sometimes need more sensation, tactile stimulation. And then also, if I think about you cooking me dinner, oh, that would be nice. Thank you so much in advance.
Yeah, I don't think so.
I wouldn't tell her that she's a bad cook if she doesn't hand cut, the food that she's preparing. If she puts something in a food processor, great. It'll still taste the same. It'll still be as delicious, but it'll be a little bit easier. There's so many ways to get from point A to point B. And sometimes just incorporating sex toys like vibrator products just make it easier, take less time, and there's nothing wrong with some quick sexual pleasure, either alone or with a partner.
So I think we're reaching our time here.
Yeah, let's see if is there anything, there's a question here, I want to learn what good foods to eat, which we addressed. Is there anything that we should absolutely avoid? What's like the big thing here? Processed foods.
Yeah, processed foods. So if you can't identify where it came from, we probably shouldn't be eating it. It really goes back to that. So we talk about anti-inflammatory foods. Really, the data suggests when it comes to reaching and maintaining a healthy weight, cardiovascular health, reducing risk or treating diabetes, reducing risk of stroke. It's really a whole food plant-based diet. Now, by no means does that mean I'm telling people they need to be pescatarian or vegetarian, but it means the majority of our calories should be coming from nuts, seeds, fruits, veggies, and whole grains.
Awesome. So eating kind of the rainbow colors here.
Exactly.
Awesome. So we are all done. Thank you so much for joining. We have incredible control over our health. When it comes to optimizing sexual function, our brain health, our heart health, our sexual health, it's just making these simple choices on a daily basis for not only us, but our partners and everyone in our family and our friends.
Yeah, and it's not waiting for dysfunction. Mm-hmm. It's really optimizing things that we have control over, optimizing our health. And like Dr. Amy said, we have incredible control.
If you'd like to learn more about nutrition and sexual health, you do have a few options. There are more resources in the Resource Center on menmd.com. You can visit this page to view sexual videos, guides, expert articles, and more. You can also call MenMD at 857-233-5837 or log into the MenMD portal to schedule an appointment with the MenMD personal health assistant. If you're interested in sexual health accessories and supplements, you can learn more or purchase these on the shop page found on menmd.com.